Truly, as a result of the COVID-19 pandemic, we've had to change a lot of things here at the Free Clinic. It has changed everything about how patients come in the door to how we train and recruit staff. We never shut down in the midst of the early onset of the pandemic, which we're really proud of, but that's because we were really needed. And so at first, it was making sure that patients who had the disease states that were the most impacted, that we were in touch with them. And then it was that people lost their job and they lost their insurance. And they were really calling and asking for services. And honestly, I know that there were people who I talked to directly who would not have been a patient of a free clinic prior to the pandemic. It's been said in the past that free clinics wouldn't be needed anymore. And always there's come a reason, something that would happen that would show how important they were in their community. And I think the pandemic has just been another one of those examples of what would this community have done if the free clinic wasn't here to take on the patients who might not have been our patients months ago, and now this is exactly what they need. In my role, one of the things I'm most proud is when I see my staff just be willing to sit down and talk to a patient about something that actually doesn't have anything to do with their job. It's not something that they ordered, that they were necessarily responsible for. When the staff will sit down and just take that extra time and go that extra mile, they care about the patients know that we care about them, and that's what we're here for. People often ask, how is a free clinic funded? And that's really important, and the people that make the bottom line possible. But to be honest with you, it's really how our free clinic's supported. There's an entire community of other providers, of other community partnerships and relationships that really make it all work. I like to tell people we have volunteers at every level of our organization. The volunteers who see our patients are exactly what makes it even possible to do what free clinics do in our community. We've had a volunteer who's been seeing patients here for 45 years, one of the very first to really create the free clinic in our community. And we have volunteers who just started seeing patients. They've been here in the community working elsewhere for years, and they just wanted to find an opportunity to come and volunteer at the free clinic. And they come back because they enjoy it. They enjoy working with the patients. The patients are grateful. And then the providers, of course, who keep their licenses post-retirement, what a gift that they want to keep on seeing patients even after they've already given years and years of service.